We've been joined today by a panel of stakeholders to share their sort of thoughts and experiences on the topic. And I will in a minute ask them all to introduce themselves. But I'd just like to ask everyone, there are two questions being placed by Tash in the chat, which we'd be really interested to, if anybody would like to pop some responses to these two questions into the chat. And if you want to include your role in practice with a clue sort of for perspective. So they are, what do you love about working in the veterinary sector? And we're actually asking this at the start of every one of these series of webinars. And then a specific one for this one, which is what do you think is the biggest cause of complaints in practice? Now, this webinar is about more than complaints. It's around increasing quality of communication and client interactions. However, we all know and we need to acknowledge that one of the drivers for this is to reduce or even avoid, even better, complaints from happening. And we know from data that communication is one of the biggest issues cited in complaints. So we're a little bit grabbing the elephant in the room and saying, yep, this is an element of this is around complaints. And we will be also including today a session from Simon, who'll introduce himself in a minute, with some myth busting around the RCVS complaints process as well, which often worries and concerns people. So we are going to look at the complaint side, absolutely, but we are dealing with much more than that in this webinar today. So our panel we have today with us are Alison, Grace, Louise and Max. And I'll ask each of them to introduce themselves and also to answer those two questions for us as well, please, if you would. So if I could start with you in a second, Alison, and then go with Grace, Louise and Max, that would be great. So over to you, Alison.
Thanks, Linda. So my name is Alison Scull, and I am currently Resolution Manager at the Veterinary Client Mediation Service, been there around 3 years. And prior to that, I worked within the Queen Mother Hospital at the Royal Vet College for over 20 years as client liaison manager there. What I love about working in the industry is just the variety. And no 2 days are ever the same. And still working with that family of colleagues, no matter where you work, it always brings us together. What I feel drives complaints in practice is can often be down to that communication, either inappropriate communication or poor communication, and looking at how we can get our clients to understand us better and use those skills is what I thrive on. Thank you, Linda.
So I'm Grace. I'm a client care manager at a referral specialist centre, also on the BVRA Council. What I love about the role is, again, no 2 days the same, the variation of the role, but also the client satisfaction side of things. I'm heavily also involved in the bereavement side. What our biggest drive for complaints, again, would be keeping clients updated along the way regarding costs and estimates.
Hi, I'm Louise. I am a lecturer at the University of Nottingham and I lead the communication skills teaching there. My experience, I've worked in clinical practice and then I've gone back to do a PhD in small animal communication consulting. So that's my background. In terms of the thing I love most about the vet sector, it's the people, the veterinary staff, but also the clients. Actually, I think they're the real fun bit and the real value added bit of the profession. Obviously, we love the animals. And then the biggest cause of complaint, I would say, mismatched expectations. So what we as a vet expect versus what the client is expecting, and that all comes down to communication.
Hi everyone, I'm Max. Thanks for having me today. I'm a general practitioner, small animal vet in the sort of Wiltshire, Gloucestershire area. What I would say the best part of the job is, I think, very much echoes what other people have said already, but I think it is the people. I think we're exposed to some amazing people, both as clients, but also as owners. And I think that makes for really interesting conversations and great exposure. In terms of where I think we see most complaints, I would say it's when people don't think they are heard.
Brilliant. That's great. Thank you. Thank you all very much for the intros. And absolutely, it's all echoing through looking at the comments in the chat. Very common themes there. around people. And yes, animals do come in too, but very much, and the emphasis on that communication, talking about money as well. And I think that's an important part of that communication piece that we know we need to probably take consideration of, and we will look at today as well. So we'll keep moving on because we've got plenty of things to discuss, and we do want to give time for a general Q&A as well as discuss the pre-submitted questions. So I'm going to start, please, by handing over to Simon Wickland. Simon is Head of Legal Services and Assistant Registrar at the college. And he's just going to really start to give us a little bit of a look and do a bit of myth busting about the complaints process, and talking about the requirements that are in our guidance and code around communicating of cost, but also where we do and don't have influence. So Simon, if you want to come on through and make a start.
Thanks very much, Linda. I'm just going to share my screen because I have a short presentation just outlining the RCVS concerns process. So we generally don't talk about complaints. We talk about concerns. There is a reason for that, but we can discuss that. So just bear with me as I hope the tech will work for me. Right, so the starting point in any concerns or complaints process is an understanding that everyone is human, apart from our patients, of course. But that means that we all make mistakes, and mistakes happen on both sides. Complaints made on a mistaken basis, but also mistakes by professionals that give rise to concerns. Veterinary nurses and veterinary surgeons are regulated professionals. They're regulated by the RCVS, and that means there needs to be a way to raise and address concerns. It's a standard part of regulation for all professions in the UK. What that means, however, is that the RCVS has a legal responsibility under its statute to investigate concerns if they're raised about individual professionals. Now, that's important. I'll talk about that a little bit more, but our legal responsibility stems from the Veterinary Surgeons Act 1966. The date's important because you'll all understand that the way veterinary services are delivered has changed considerably since 1966. But the key shortcoming, I would say, is that we, the RCVS, don't have statutory authority to deal with, through a disciplinary process, complaints about practices. So as you can probably imagine, in 1966, the majority, if not all, veterinary practices were owned, operated by veterinary surgeons who were individually registered with the RCVS. So it meant that de facto, the RCVS had control over the way veterinary services were delivered through the professionals that were registered with it. That situation has changed. So it does leave a rather large hole where concerns are raised by members of the public about practices or unidentifiable individuals. The third point to really make from the start about the complaints process is that because of the way the legislation is drafted, we can only deal with the most serious concerns. So most professional regulators will now talk about things that may impair or affect fitness to practice. In actual fact, the language in 1966 legislation talks about disgraceful conduct in a professional respect. I always think it's really important to go back to that language because it helps people, I think, to understand just how serious the behavior has to be in order to attract disciplinary action by the RCVS. Disgraceful conduct sounds something truly, truly terrible, and generally implies some kind of intent, bad intent, things at the most serious end of the spectrum. It's always helpful, I think, as well to compare with the doctors who had in their legislation of the same date, the legal test for action was infamous conduct in a professional respect. I'm not sure I understand the difference between disgraceful conduct and infamous conduct, but hopefully the point is clear that it's something very, very serious before the RCVS can take disciplinary action under its statutory disciplinary powers. So what are we really talking about? And we translate this disgraceful conduct or this impairment of fitness to practice. Normally, we're talking about serious professional misconduct. That's behavior that's fallen far short of what is expected of a veterinary surgeon. And those three examples on the slide are by far the most common concerns raised with us that result in disciplinary action. So where we're talking about clinical things, it's very poor professional performance where there are serious departures from the code. And that's in plural on purpose, because in most cases, a single departure from the code, unless extremely serious, is unlikely to reach the threshold. The second example there, fraud, dishonesty, or false certification. For obvious reasons, I hope people will understand that anything that undermines the integrity or honesty of a professional whose relationship with patients and clients is based upon trust is really serious and has the potential to impact on the wider profession. So anything of that nature tends to be treated very seriously. And again, it implies that aspect of intentionality. You've been dishonest, you've done something wrong. It's not something that's happened accidentally. And then finally, criminal convictions. I would say quite a large proportion of cases that end up before the disciplinary committee relate to convictions for serious matters. Again, criminal convictions are likely to impact on public confidence in the profession as a whole. And that's why they're treated seriously by not just the RCVS, but other professional regulators as well. So that's what we do look at as part of the concerns process. It's probably helpful, though, just to limit or to describe what we don't deal with. So there's some real understanding about the coverage that the RCVS disciplinary process has. So I talked about sort of accidents. We're not looking at difficulties or problems that occur routinely in practice and are nobody's fault. So the example I've given there, post-operative complications. Professional regulatory disciplinary processes are not designed and they're not there to punish individuals. They're there so that people learn from their mistakes and so that they don't happen again. In the vast majority of cases, that can be done without the need for any disciplinary action by a professional regulator. Just to say, the legislation from 1966 doesn't provide the college with many options when it comes to taking action about concerns. At the moment, we have the ability to suspend or strike someone off, remove them from the register. We don't, for example, have the ability to impose conditions or other actions that might be designed to help remediate and prevent recurrence. It's one of the shortcomings of our current legislation. We also don't look at mistakes that are not serious and don't affect fitness to practice. So I said at the outset, we're all human. Professional regulation understands and acknowledges that. We're not looking at negligence. Obviously, members of the public, clients, have the ability to take civil action against practices and veterinary surgeons where there's a damage as a result of negligence. That's not a matter that will normally meet the threshold for RCVS concerns. And finally, again, I'm referring back to the individual nature of the RCVS jurisdiction. We can't deal with complaints about practices or unregulated individuals. Just to note, we obviously look at illegal acts of veterinary surgery by unregulated individuals. That's by way of criminal referral or investigation. But in terms of our process, our disciplinary process, we can't look at members of practice staff who are not veterinary surgeons or registered veterinary nurses. It is important to point out, though, and we're helpfully joined by a colleague from the VCMS, there is a route for individuals with complaints about practices. Sometimes the nature of those complaints will cross over into matters that address individual fitness to practice or serious professional misconduct by an individual veterinary surgeon, but often not. And there is a route for those complaints to be dealt with through VCMS. I also want to point out that although it's not part of our statutory function, through our college charter, we run something called a practice standards scheme. And while that doesn't involve a complaints resolution process, it does require practices who are members of the practice standards scheme to have a practice complaints process. And also, we do have the ability to take on board concerns raised about practices when we're carrying out our assessments, which take place on a 4-yearly basis as part of PSS membership. But it's not, strictly speaking, a disciplinary process. So the outline of the process on this slide shows that first stage when a member of the public or a veterinary surgeon contact us to raise a concern. So it's essentially a triage stage. And the arrow going off there to the left with ADR, which is Alternative Dispute Resolution, is essentially VCMS, which is one of the ways in which concerns that don't or are unlikely to raise issues of serious professional misconduct can be directed to VCMS for possible resolution. So if that inquiry or triage stage establishes that it's about an individual and that there's a matter which might raise a serious professional misconduct issue, it goes to that stage 1 assessment and investigation. And essentially what happens there is evidence gathering to establish whether or not there is a realistic prospect of a finding of serious professional misconduct. That's all very legalistic, but it's essentially, is there a basis on which a decision could be reached that this person has behaved in a way which is serious professional misconduct? At the conclusion of that stage 1 investigation, a matter is referred to the preliminary investigation committee. For veterinary surgeons, it's very likely that until that point, the referral, they may not know that a complaint has been made to the college. That's for very good reason. The vast majority of complaints are either closed at that initial inquiry triage stage or are directed to other sources of advice or assistance. The college's position is that it's really important not to unduly alarm professionals where there are complaints that are closed at an early stage. Certainly, we understand the impact that complaints can have on individual professionals. So we contact veterinary surgeons and registered veterinary nurses at an appropriate point where a complaint is in the process, the more formal stage, which is preliminary investigation committee and then disciplinary committee. So the PIC, there's a separate PIC for vet nurses, is made up of individuals that receive cases, receive the evidence, and they make a decision about whether or not that case meets the realistic prospect test, i.e., is there a realistic prospect that the disciplinary committee will make a finding of serious professional misconduct? So you can see there 20%. That is 20% of complaints that come in reach that preliminary investigation committee stage. And I'll give you some numbers at the end so you can put that into context. So if the PIC conclude that a referral is necessary, it goes on to DC, disciplinary committee. But the PIC does have the ability to close the case. It does have the ability to impose warnings about future conduct as alternatives to that referral. I think it's also important to point out that until stage 3, this process is confidential. Only the parties involved know about it. The reason I say that is, as a legal professional who's practiced in the courts, the disciplinary committee hearing is very formal, very public. It's akin to and on a level with any other judicial proceedings. There is a huge difference in approach. All the parties will be represented by lawyers. And it's only fair then that it's 2% of complaints we receive that we're talking about that arrive at that final stage. So to put that into context in terms of complaints that we receive on an annual basis, we get about 600 concerns raised with us. So 2% of those, we get about 20 hearings on average a year before disciplinary committee. It's a very, very small number. I think it's important for veterinary professionals to consider, and I'm just talking about vets in terms of numbers on the register, but there are over 30,000 that are practicing. And when one considers how many interactions there are with clients on a daily or even hourly basis, the fact that that results in only 600 concerns being raised with the college a year, I think is important to keep in mind. The vast majority of veterinary services are provided by vets in a manner which does not give rise to concerns or complaints. And even then, we're talking about 1 to 2% reaching that final serious stage of a disciplinary committee hearing. I'm just going to come out of that now and then just touch on a couple of points that have come up recently around communication and consent. I've already talked about why we have limited tools at our disposal given the age of our legislation. And I think it's a situation that's common to many professional regulators that consumer priorities and terms of business have not traditionally been part of the remit of professional regulators. Many of our brethren professions have regulators with much more up-to-date legislation, and some have clearly focused on the consumer aspect of services they deliver. So I have in mind financial and legal services. But if we compare with, say, more similar professions, those in particularly in human healthcare, the reality is they do not address in a way that I think the CMA has indicated it would like the RCVS to address issues around consumer concern, communication, particularly of treatment options and prices. This isn't anything new. We've had real difficulties, I think, because we just don't have the powers beyond putting things in the code of conduct and then taking disciplinary action in those very few cases that meet the threshold in our legislation. So I think what that means effectively is, although something might be in the code, a single departure from the code, particularly if it's not a particularly, sorry, I've used particularly twice there, but if it's not something that is so serious, it's very unlikely to pass that initial threshold at PIC, meaning there's no realistic prospect of a finding of serious professional misconduct. And that's partly influenced by the fact that the outcome in our disciplinary process is removing someone from the register. And for obvious reasons, that appears disproportionate if we're talking about a failure to communicate effectively a price. I'm not saying that's never something that might end up before disciplinary committee, and multiple examples of failure to communicate have and could be matters for the disciplinary committee. But perhaps you can understand that there are very few cases around communication and consent on their own that are likely to wind up before the disciplinary committee. Just on what we already do about communication and consent, there are 3 fairly chunky chapters in supporting guidance to the Code of Professional Conduct that address communication and particularly communication around costs. Chapters 9, 10, and 11 of the supporting guidance go into some detail on how members of the professions should comply with the code obligations on communication and consent. They're quite in-depth and they're comprehensive. It's important to say, though, what we don't do is give you a prescription for how to communicate, what should be on a price list, if there should be a price list. In common with many professional regulators, we have continued on the basis that the way professionals communicate with their clients is a matter of professional judgment. And if they adhere to the principles set out in the code, then that's appropriate. That is something that may well change depending on the view of the Competition and Markets Authority about potential harms in the veterinary services market.
Great.
That's a really, really quick, super quick and slightly superficial overview, but I hope at least it puts everything into context, and I would be really, really happy to contribute more to the cost and communication point as the discussion goes on.
Brilliant. Lovely. Thank you. Thank you very much, Simon. Just want to ask you, those figures that you put up around the concerns and the difference between complaints and concerns, Obviously, a lot more complaints than that 600 come into the college. So when a client says, I'm going to complain about you to the RCVS, it's not 2% of that time that end up there. It's when it goes to a concern level, a lot are weeded out because they don't come under the remit as explained.
Yes,
So yeah,
that's a really good
so
point.
keep that complaint and concern difference to mind. A couple of other really different angles on what they love about being in the veterinary sector have come in. One commenting on that role we have around being able to influence things at a global level, global health and well-being through our involvement, particularly obviously currently in the livestock sector, but that increasing understanding of the importance of the veterinary voice in the One Health agenda is a really key one. And also the comment around time being a factor in complaints, and that if we don't have adequate time with our clients, and I think that's something else we will look at today. So moving on now to two members of our panel who are going to just talk a little bit about the positive effects of good client communication and considering client perspectives. So if I hand over to Lou and Alison for that, please.
Okay, so just a few slides here. Some of you, I realise I will be preaching to the converted on this one, but I thought it'd be really helpful on this webinar to just have a look at what we know from scientific research about communication. So we know, and all of these things have come from research papers, and if anybody wants the original source, then pop it in the chat and I will try and direct you in the right direction. But we know that if we get communication right with our clients, our consults are more effective. And what we mean by more effective is we're likely to be more clinically accurate, we are more efficient, there is more trust between vet and clients, and there's an improved vet-client relationship. So there's some great reasons to start why communication is so important. We also know that good communication, getting it right, is really, really important for coordinated care. So we no longer work as, in necessarily tiny teams. Often, actually, there are a whole load of paraprofessionals and other veterinary professionals involved in the care of animals. And if we communicate well with them, then that animal is getting better and more coordinated care, which is a really good thing. We also know that actually we get better medical outcomes if our communication is right. So the research shows that if we communicate well, our clients are likely to be more satisfied with the consult and with their experience, but also actually as vets, if we're communicating well, we are more satisfied with our consults. And that's a really, really good reason, particularly in light of, our well-being concerns within the profession. Actually, learning how to improve our communication can actually make the job a lot more satisfactory for us as vets, and that's really, really important. We also know that if we do it well, our clients are more likely to understand what we've said and remember it after the fact. And all of this feeds into the fact that means our clients are more likely to adhere to the recommendations or the treatment schedule or whatever it is that we reach at the end of the consult. And that's really, really important, because if we have recommended a course of antibiotics, actually that patient receiving the full course is a really, really important thing in order for that animal to get better, as an example. We also know that good communication improves the quality of care. So we are safer practitioners if we're communicating well, and we're less likely to make mistakes, which is obviously really, really important. And we're also less likely to receive complaints and malpractice claims, which obviously we've just heard a little bit about. And if I still haven't convinced you, there is one really interesting paper out there that looked at using something called a relationship-centered care approach in our communication. And that's relationship-centered care, a lot of overlap with contextualized care, which we're hearing a lot about at the minute. But they found that if you use this relationship-centered care approach, which is understanding that clients are an expert in their own right, that pets are very, very important, and there's an important relationship there that we need to take into account. If we use that approach, consults are on average 1.5 minutes shorter if we take the time to build a relationship with our clients. So just to sort of pick up briefly, and I'm really sorry if you can all hear the bin lorry outside of my house. actually taking those approaches, we know that we are time pressured and that can massively affect communication, but taking a little bit of time to work on that relationship and to understand what that animal means to that person, and get their perspective on things actually can help us with that. It's not something that's going to necessarily make our consults take longer. Like I say, research has shown that it can actually reduce consult length. So just a few reasons as to why all of these things are really, really important to get right. Can we have the next slide, please, Chloe? Okay. So this figure here is something that came out of my PhD, which I mentioned at the start, was on small animal consultations and what does good look like. And that was good in terms of for the client, also for the patient, and also for vets. And one of the big things that came out of it was that we as vets, veterinary professionals more broadly, are really good with animal behaviour. We spend a lot of time studying that at university. We can read dogs and cats and horses and all of that jazz, but what about the person on the end of the lead rope, leaning over the gate, you know, at the end of the lead? And this figure came out of lots of conversations with vets, clients, etc. And hopefully this will sort of help you see a little bit more and feed into the discussion later. I think as professionals, we're very, very focused on a particular animal and its disease. So you'll all have had, you look on the practice management system and it says dog with lump. Okay, and this is a fictional example running alongside. Okay, so this isn't a real dog. So you know that you've got Alfie, he's coming in, he's 13 years old, he's a Labrador and he's got a lump. Okay, and already in our heads as veterinary professionals, we tend to pattern spot, and we're probably already thinking, oh, well, you know, older Labrador, probably a bit flabby, might be a lipoma. We're already starting to have those thoughts in our heads because that's the way human brains work. And I guess using a relationship-centered care approach and understanding sort of the human side of things is actually, there's a waterline. So we've seen those two things at the top of the pyramid. Underneath that waterline, attached to the end of the lead, attached to Alfie, we have a client. Okay, in this example, it's Mrs. Smith. And she has a family situation. So she is married, she has 2 grown-up kids, the dog is the remaining offspring still in the nest. Okay, he really is part of the family. She's got a little bit more disposable income because the kids have moved out and have got their own lives, careers, jobs, etc. So there's a little bit more money than they were when the kids were small. And then she's got other stuff going on in her life. So in this example, her father has recently been diagnosed with cancer, and she believes that Alfie is a firm member of the Smith family. Okay. Understanding that there are all of these other things going on under the waterline allows us to have better conversations with our clients, allows us to understand their perspective, and it allows us to make better individual decisions as to the advice we give and what might be best in this case for this patient. Okay, I'm not in any way saying you need to go out and say, okay, Mrs. Smith, are you married? Do you have any children? How much spare cash have you got lying around? Absolutely not. But by taking the time to talk to our clients and picking up on the little cues that they drop in conversation. It may be like, oh, you know, we had the kids round for Sunday dinner, for example. And you go, oh, that's great. You know, do they come often? It's a real opportunity. We pick up on these cues from our clients to build some rapport. And by doing that, we're building trust, we're building a relationship. And if you remember from the slide before, we're hopefully making our consults run a little bit smoother and a little bit quicker. Okay. All of that said, we are all individuals, okay? And that's vets, that's clients, that's everybody. We all come with our own situations. We all come with our own beliefs and values and biases, okay? And it's really, really important that we try and account for those, try and understand what our own are, put them to one side and really listen to what it is the clients are telling us, because that's our role, to advocate for animal welfare and to help the clients when they've brought their animal to you. Ultimately, they have presented their animal to a veterinary practice because they are concerned about them and they care about them. And I know it's very, very easy if you've had a really tough day, you might be feeling a little bit burnt out, to forget that. But ultimately, they come to seek veterinary care because they care, and it's our job to work with them to help improve that welfare of the animal. Alison, have you got anything you want to come in on at this point? I keep talking.
Yeah, so when we look at the iceberg effect, we can also look at how that can drive behaviour. So it can come that Mrs. Smith comes into the consult with Alfie, and if she's displaying a behaviour, maybe that she's over anxious or really concerned, is it because she's worried about that lump being cancerous, bearing in mind what's going on in her home life? And there's so many times where a behaviour can be driven by something that's going on completely irrelevant to that situation. And by getting to know our clients more and communicating well and passing on that information within practice, we get communication skills better and we get the best outcome ultimately. And sharing that information within our practice, you know, if Alfie's coming back next week to see a different vet, or coming in for a weight measurement, for example, sharing the information that you've learned about Mrs. Smith will help your colleagues going forward.
Okay, so we've talked about how important the client's perspective is and this relationship-centered care, contextualized care approach, but how could we actually achieve that in practice? Because it's all very well saying you need to do it, or we recommend that you do it, but the reality is how do we do this? Okay, so number one would be listening. Often actually humans, clients, you know, we drop cues to how we're feeling often. So it may be in our body language. You know, if a client is there with their arms folded, actually perhaps they're feeling uncomfortable, they're feeling defensive. If we can pick up on some of those body language cues, then we can start to sort of think, okay, perhaps they need more from me, or I need to find out what else is going on. Okay, so number one, listen to what they're saying, also listen to what they're showing you. Okay, empathy is a massive one here. So actually it's really stressful living an adult life, put it like that, but we've all got stuff going on, you know, MATs that need to be booked, children's appointments that need to happen, you know, bills to pay, mortgages, etc., etc., etc. And just understanding, you know, these people, like I was saying earlier, they do care, and they do want to do something about their pet, and just being empathetic to actually life is tough for a lot of us, and understanding that, you know, say you're prescribing eye drops 4 times a day, the reality, if you've got young children, is that that's going to be really actually extra hard. And it's bearing those factors in mind and having a conversation with the client, like, actually, is this going to be workable for you and your situation, or do we need to come up with an alternative plan? Sometimes there aren't alternatives, and we are sort of pushed down a particular route, but certainly if there are options, understanding and empathizing with the client and what it's like to live with an animal with, say, diabetes, or an animal that's getting older and is incontinent in the house, actually, you know, that's not easy. It's absolutely not. And showing them a bit of empathy can go an awful long way. In terms of what you can say to sort of maybe try and draw out some of this information, there's something called ICE, or Ideas, Concerns and Expectations, and it's talked a lot about in medicine, and it's perhaps not talked so often about in veterinary medicine, or is starting to come through. And that's understanding that clients will come in with an idea. It may be that they have Googled it, or they've been on a forum and got some information. So understanding what it is they think might be going on can be really, really helpful in guiding your conversation. If, for example, they come in and say, I'm really worried that my cat's got Cushing's because XYZ, and you go, okay, right, I understand why you think that, but perhaps something else may be a little bit more likely. It shows them that you've listened to their concern, but helps you drive the discussion away from that. If you don't ask them what they think might be going on, then potentially they may leave the consult and think, well, that vet, you know, I still think it's this, because you didn't address it. Okay, so it's understanding, you know, why are they here? What do they think is going on? If they come in for something, and the classic one is the nail clip, isn't it? They come in and you find something else on physical exam. If you don't address the fact that they wanted their pet's nails trimmed, even if that's not particularly important, you know, clinically compared to what you find on the exam, unless you sort of say, I think we need to get this bit sorted first, and then we can look at getting him booked in to get his nails sorted, then actually they may leave and think, well, you know, I still didn't actually get what I came in for. And it's not that you as the vet have done anything wrong. You've picked up something more serious that needs dealing with more urgently, but it's about managing those client expectations and letting them know, I have heard you and we will get that sorted sorted, but right now my worry is this. And for the sake of Fluffy, I think we need to proceed with this bit first. It is certainly a really, really important thing today. It's also really important to try and find out what they're most worried about. So thinking back to Alfie, our example, like Alison said, in this example, Mrs. Smith's father is ill with cancer. It may be that she is really, really worried that this lump is something nasty. If we, as vets, we see lots of lipomas, and it's not something that we would necessarily worry about unless it was huge or causing the animal significant issues. But actually, if you know that the client is worried about that, then saying, what are you most, giving her the opportunity to say, I'm worried it might be cancerous, may guide your decision as to when to do more diagnostics sooner than potentially you might have chosen to do otherwise. Okay. Actually, if you say, well, the only way we're going to know is to take a sample of this lump, then actually you can progress things on. The owner feels heard, and you've made a decision, understanding a little bit about their context, and they're going to leave feeling like you actually listened to them. Okay. Another one in terms of expectations is, what do they hope you will be able to do today? So we've had, I've certainly heard of complaints about, the client wanted an X-ray. And unfortunately, for example, in terms of busyness, it may not be possible to do it on that day for all but, dire emergencies. Understanding what the client has come in expecting, I was hoping you would be able to start the tests or get something booked in, etc. If you understand what they're expecting, then you can either meet their expectations, or you can help discuss, sort of reframe their expectations. Say, I agree with you, for example, that an X-ray would be a great next step. We're currently, it takes about a week to get those organised, so we will certainly organise them for you. Again, the client is going to feel like you've taken their concerns seriously, assuming an X-ray is warranted, but also you're not basically always never going to be able to help them with that, if that makes sense. So it's understanding what they want from you. And then the final thing, and then I will stop talking, is understanding what the client's starting point is. Okay, and that's really, really good for everybody. Say you have a newly diagnosed diabetic. If you speak to them and say, have you got any knowledge or experience about diabetes? They may tell you that they have it, their family member had it, they've had a cat with it before, etc. They may be a human endocrinologist, okay? And understanding that's going to save you a lot of time in terms of you can then formulate your discussion and information to their level. Equally, say, have you got any knowledge or experience of this? And they say, no, none at all. And you're right. So you know that you need to start back with a little bit more basic information before giving them more info. So those are really, really, in a nutshell, important and good ways to try and get the client's perspective. Alison, have you got anything else to add on?
That's fine. Thanks, Lou.
Great. Thank you very, very much, both of you. Lots in there, Lou, which will take us very nicely on to our Q&A for the panel. I thought you great points in there, made that lovely point about our everyday is probably a unique situation for that client, and we need to remember that and those sorts of things. And lots of comments around understanding the human. So if I move on to the pre-submitted questions which you sent for this webinar, we've grouped them into some themes that have come through, and I'm going to go to the panel and ask for them to sort of give their experience and thoughts on these questions. The first one is really around learning from our perspective as vets around human behaviour, human psychology, to improve that communication style and skills, and getting in there at that early stage. And you obviously talk quite a bit about that there, Lou. But what resources can we guide people to? Where to start? What's helpful? How should we think about this sort of thing? And what have we learnt in our time? So perhaps if I can start with Alison, your thoughts on this one, and then if you'd hand through onto the panel if they've got anything more to add, that'd be great.
Yeah, I think there's so much learning out there at different levels, and about understanding the client's behaviour and psychology is sometimes that we oversee, certainly at vet school level, where if you can just understand a little bit more about how clients think and their expectation, it really supports down to the basic consults of being able to address that and communicate better.
Thank you, Alison. That's great. Grace, any thoughts from your perspective?
Yeah, so I think it really dips into the client journey and active listening. So really thinking about the peak end rule, where the client will always remember the most intense moment of their journey and then the very, very end. So when you are at that investigation level of a complaint, really investigating where that intense moment was, whether that's good or bad. And then when you are at the complaint level and resolving it, really dipping into the very end and making sure that they walk away feeling listened to and heard and part of the outcome.
Absolutely. Thank you very much. Max?
Yeah, I really enjoyed that. I was actually taking notes throughout what Louise was saying there. And it's sort of a few points sort of resonated with me a little bit, because at work I get sort of a lot of stick for having lots of conversations completely irrelevant to the patient. So you're asking how they're doing, how their holiday was, has their son, daughter graduated from university? And actually, I think that side of things is really interesting, because you do learn things about people. And then that then helps to inform how we communicate with these people and the outcomes. And worst case scenario, if you learn nothing, you've then just possibly had an interesting conversation with someone. I think also there was another point that resonated in that. I remember someone once said something when we were dealing with a post-operative infection, and that it was that this may be 1 in 100 or 1 in 1,000 for us, but for this person at this time, this is their 1 in 1. And I think it's us trying to relate to people and trying to put ourselves in their shoes that I think is really relevant.
Absolutely, thank you. Lou, if I can ask you to come in again on that, and maybe comments coming in around the impact of the fact that there is money attached to our conversations with people, and we make a charge and there are costs, and the impact that that has, and how we work on getting those conversations had, and how we can learn to get better at doing that, and the not losing that positive side to it to go forwards. And another question is coming around how much is being done in the education world around this, and you're obviously based at Nottingham.
Okay, so I'll answer the second question first, if that's okay. In terms of what's being done in the education world, I can only speak for what is at Nottingham, but certainly our students are getting training on, client expectations, relationships, centre care, etc., from year one. So certainly our graduates are definitely getting it. But certainly there are also excellent communication skills programs at other universities too. And certainly every school does teach communication skills and professionalism throughout their course now at UK universities. It is part of the course. So that is question 2 answered. Question 1 around how do we communicate cost, or how do we learn to communicate
understanding the impact that, the fact there is money involved and we're going to make a charge and there's payment considerations, and the impact that has on the relationship building, and where we can work on our confidence with that and understanding what we need to do.
Yeah, so in terms of what clients expect, there's been some very interesting research into this. Mine is very much, there's a paper on that. And actually they spoke to clients and they expect the vet to raise the cost discussion, okay? I think the other thing that's really, really important to remember is that clients are expecting to pay something, okay? I know we didn't necessarily go into this because we wanted to charge people money to look after their pets, but unfortunately, it is a business and it does have to function as that. I think understanding that, clients are they don't expect this for free, should hopefully give us some confidence in talking about it. In terms of how we can talk about it in a way that we feel comfortable with, I would always advise, let's talk about value, okay, rather than price. So we say you recommend that an animal needs some a blood sample doing, because you're concerned. Actually, if you say the blood sample is £100, although I realise that actually is probably going to be significantly more than that, depending on what we're sampling for. But let's go with £100. Okay, it's £100. Do you want to do it? And the client's like, oh, well, £100 is a lot of money. Lots of people don't just have that lying around. If we talk about it and say, I think a blood sample would be good in this case, because actually it's going to give us some information about Rover's kidneys, about how his liver's functioning, about his red and white blood cells, which is going to tell us how, it's going to tell us some more things about what's going on. It will help us rule in or rule out some things, some of the big diseases that we're worried about. The cost for that blood test is £100. That is going to sit a lot better with a client, because they understand what that money is being spent on and the value it's going to give to the discussion. If they then say, well, actually, £100 is more than I can afford, then you can talk to them and say, okay, well, actually, we could do a urine test, which is a little bit cheaper. It doesn't give us quite so much information, but it can still tell us about a little bit about what the kidneys are doing, if there's any sugar in there. And then you can start to negotiate, as to what is affordable for them, and tend to use that language as well, or would recommend using that language. So, is that affordable to you, without judgment? I realise that is a lot of money. Is that affordable at this point? And it gives them that opportunity to say, yes, actually, I thought it was going to be more than that. And you go, phew, you don't say that to the client. Or you go, okay, right, I understand. Right, let's talk about another plan. How else can we move this forward? Because they're coming to you. They would love you to fix their pet instantly in a consult, but in reality, they want to leave with a plan. Okay, we like diagnosis, we like to fix things, but the clients are actually looking for advice for progress. And so it's understanding that. I could talk for hours about this, sorry.
I know. No, you've gone again around that expectation meeting piece that we did talk about. And I think there is that real value in us as veterinary professionals getting a focus on our non-clinical learning, doing that non-clinical CPD, seeing it as valuable. We've popped a couple of resources in the chat as a start off to kind of point us in the right direction. There's a lot of provision out there, but it's quite hard sometimes to engage clinicians in spending their time and money on doing this sort of learning and development. We tend to be keener on clinical CPD, but the value it enables us to use our clinical skills to better effect when we also improve our learning in this area. So just going to go on and talk, before we open it to the floor for questions from today, we may not get through all the questions that we had pre-submitted, but there's one around how we can most effectively prepare the client from the point of making the initial appointment, their arrival in the practice, and then their arrival in the consult room. So there's different stages of the journey and how we can work together with the people involved in the different parts of it. So Grace, do you want to talk a little bit about how you start from that?
Yeah, definitely. So obviously I'm at referral level. But you can apply this to local as well. So obviously for the client's journey, their first impression and their first start of that is on the phones at point of booking. So at a referral stage, we will run through a checklist. And actually the first question that we will ask the client is, how is your pet at the vets? Do they get anxious? Are they nervous? What's their temperament? And then touch on to the client needs and what they need. And I think that's really important because straight away it sets up a positive client experience and they feel that they have a say in their experience already. At point of arrival, we will make notes on the file of that telephone conversation. So if the pet is anxious, we ensure that we've put the time into taking them straight into a room so they have that private space. And then throughout their journey, it's just all about making sure that they're happy, they're kept updated, and that they feel that they are part of the decision making. So, it also touches on the medical terminology that's used, and sometimes they don't understand that, and it can be quite confusing for them, especially at a specialist level. So we have fact sheets that we can give to clients based on conditions, and it's just really making sure that they feel involved in the journey and the decision making.
Thank you very much. That's great. Max, any comments around that preparation piece and how they arrive with you in the consult room?
Yeah, sort of just echoing what Grace has said. I think the first telephone conversation is so vital because it's where you start to build that trust as a practice. And I think often it is undervalued, and sometimes it's really tricky, isn't it? If you've got multiple phones going off at the same time, but ultimately you need to prioritize the people that are in front of you at the time. And again, understanding what their expectations are, because they may be going to you because they've had a bad experience elsewhere, and it could be something that could be avoidable for the future. So, for example, like one thing that we do if we've got a puppy that's coming in is that sometimes one of the nurses will come out and just spend a bit of time with the puppy in the consult room, just build a bit of trust, try and get a bit of a gauge for the relationship and what they're expecting of that. And then obviously when they come into the consult with one of us on the vet team, then we're just building on that, and it's a continuation. It makes us feel like we're all part of a team, hopefully working towards one thing.
And that's actually a really good example of that, investing a bit of time to reduce time needed in the future to get good outcomes, where you've built that trust and started to build that relationship from very early on in the client journey. Thank you. I'm going to keep going with some of these pre-submitted questions. We had a big piece around understanding the client's concerns and motivations for being there, which I think you covered really well, Lou, in your presentation. So hopefully those have been answered. Another theme was around our use of language and the types of language that we can use to get good responses and compliance from clients, especially when talking around, I use the word slightly advisedly here, sensitive subjects. The classic one being around the conversation around insurance and is the pet insured? And whether we've got any comments from the panel about constructive use of language to help us get good responses in these situations and tackle these situations with more confidence.
I think Louise covers some quite nice information there about how pre-framing the subjects. And I think the insurance is a big one because you ask it too early, and you can see in your complaint letters all they were interested in money because they asked me if I was insured. And if you ask that question correctly, it can be used so much better in the sense of, what contextualized care options we offer can depend on what finances were available. So using that conversation and pre-framing that in, you may have spoken to our administration team this morning and just to check that they covered your insurance documents, etc. You automatically get a feedback then, well, we're not insured, or well, we told her we only had this sort of budget. So it's not asking that straight question, are you insured? Because they automatically think that the treatment level you're going to offer then is either within their insurance limit or is having an effect being driven by costs.
Okay, thank you. Lou, did you want to come in with something on that, please?
Yeah, totally agree with Alison. If you come straight out and say, are you insured? There is definitely, and this came out in my PhD as well, this preconception that vets have a different price, insured versus uninsured, which is really sad, to be honest. In terms of when to bring it up, it can sometimes be helpful if you lay out the options and then potentially say something like, this would be something that would be covered under pet insurance. Have you got any, or are you insured at that point? Because then you're saying it after you've given them the options. There's not like this is the option, this is how much it would cost. It would be covered if that is something that you had. Can just kind of, it's a different way of approaching it, and can sometimes soften it a little bit and not leave them thinking that you've given them different options because you asked them that question first, if that makes sense.
Absolutely, and it is that power of language, and if you're insured, it will be more than your excess, so you might want to make a claim. Well, most people will give you a lead then as to whether or not they are insured. And as you say, you've laid out the options irrespective first, but you are still going to talk about money because, as we said, there will be a bill attached. Max, any sort of thoughts from your perspective in the consult room?
Yeah, it's a really interesting one, isn't it? Because I think we make an assumption that if an animal is insured, that we will be able to offer more treatment plans. And sometimes that's not the case. Sometimes people don't need insurance or don't believe in insurance or insure in a different way. So I think that's one key thing is it's not assuming that because someone is insured, they will want to do something. Because some people are insured, but ethically don't feel that chemotherapy would be appropriate, for example. And that, I guess, comes back to us understanding the client and the way that they behave. I think it is important to a degree to know that they're insured because some people on the flip side also are unaware that they would be able to be covered on insurance. And then that's interesting because then possibly people are more reluctant to pursue an option because they're not sure if that will be covered under insurance. So I think it is the elephant in the room, and I think it's appropriate to have a conversation, but equally we have to be careful that we don't make assumptions according to insurance.
Yeah, assumptions, absolutely always a problem. Grace, can I ask you, sort of reactions you tend to see when you're doing that preparation work with clients? And I appreciate you're talking from a referral setup, and there are some differences there, but you've got wider experience and connections.
Yeah, so definitely there can be some negativity towards insurance questions, financial questions, but I think it's key just to manage that expectation. And when you are, as Alison was saying, it's all about the wording. So when you are asking about finances and insurance, it's making sure that you word it in a positive light, showing them that actually we're asking because we want to help. We want to make sure that we manage throughout the journey the correct treatment plans for them. And I think as well within that, it's important that all team members are aware, from client care through to the nursing team, through to the clinicians.
Brilliant. Yeah, thank you very much. We're never ending talking about communication. And there's one question in the chat about recording that contextual information, which you referred to in your iceberg model with Alfie and Mrs. Smith, in a GDPR compliant way. And I think one of the things to start off is animal information doesn't come under GDPR, but obviously we're thinking about our contextual information about that person at the end of the lead as well. Alison, have you any comments on that question, please?
Yeah, I do. Clients who ask, obviously, and they're absolutely entitled to see their clinical records for their pets, sometimes come to us through mediation and really upset and offended by what's been written. And I think we need to just remember whenever we're putting clinical notes out in practice that the client can absolutely read those, and we need to be really sensitive to that. I think Grace's journey initially is our receptionists are our eyes and ears, and to what's going on and passing that information on, also putting it in clinical records. And as long as we keep it factual, we're absolutely covered. And I think it's fine for a client if you obtain something that's quite personal to them. There is no harm in asking the client, is it okay if I put that down on the computer system so that Max, your vet, knows that when you come to see him? And you're just showing empathy to the situation that they've shared with you, but you're covering yourself by that being okay put in the clinical notes.
That's it, isn't it? Being confident to ask that question, showing that empathy, being clear and transparent about what we're doing. There's sort of common themes coming through this, and we've got something similar coming through in the chat, and this actually lands very positively with clients, and exactly as you're talking about, it's empathetic and helping them, and it is supportive. Thank you very much. That's good. We had another question around dealing with situations where the client is very emotionally charged. We addressed this when we looked at the iceberg model. We don't know what else is going on. But are there any sort of particular advice, languages that we can talk about? I appreciate we need to be a little bit mindful of time, but I think this is a good one to help us manage those conversations when we're dealing with clients where perhaps their rational brain is not the dominant part at that time. Anybody got any sort of comments around that they'd like to bring in?
I can help maybe.
Thanks, Max.
I think the key one in this is whether or not they're emotive through anger or just through stress. I think the key thing is to try and relate to that and to try and hear what they want you to hear, and then to try and pick out from that, because sometimes people can wave for 5 minutes and you think, oh, I don't quite know what I should be taking from that. So almost what I try and do is I almost give them the opportunity for me to listen and for them to put across their point, and then I try and pick out a few key points and ask them if they think that is a fair assessment or synopsis of where we're at. And then again, if it's not, then it gives them an opportunity and then we can go back to the drawing board and almost start again. But yeah, I think, as I said, it comes back to just giving people your ear and an opportunity for them to be heard, because sometimes people just want to be heard, because they're not being heard elsewhere in their lives, or they don't feel necessarily that they've been heard by one of the other people in the team, or vice versa.
Thank you, absolutely. And that's that real technique of coming back to them and showing that you've heard what they've said, even if it can be quite difficult to pick out, and de-escalating situations as well. And that's a skill. You'll watch people in other walks of life who it is their bread and butter, and it is a skill we can learn.
Is it possible to make a comment?
Literally, we're getting to the end, but please do, if you can be brief or pop it in the chat.
Yeah, if I can be brief. I mean, one is I'm impressed with the client interaction that you're promoting. Louise's stuff was absolutely fantastic. I wrote in the chat, what about the 10-minute time that is limited in many of the corporate vets? How do you fit all this into the 10 minutes of getting answers of what you're doing? And the other thing is, nobody has mentioned the receptionist. The role of the receptionist is obviously becoming critical to cover some of these. A highly talented person at the front desk who's going to do a lot of this interface. Okay, that's all I wanted to say.
That's great. Thank you. Absolutely. I think my takeaway from today has absolutely been the one around time and how we can actually shorten our consults with better conversation. But we'll just very quickly ask the panel to do that for literally a minute. And in terms of the role of the front of house, absolutely, we are focusing on that. And we do have Grace here, who's representing the BVRA and in her role at front of house. Can I ask Lou for one short comment around the 10-minute time factor? That's not universal. Not everyone is working on 10 minutes, but the concept of working in maybe an inflexible time slot situation of however long the duration is.
Yeah, I guess it comes down to clients are hoping for a plan and some progress. They don't necessarily want you to fix everything in 10 minutes. So it's understanding their expectations. What is the agenda? What is the list of problems that they are coming to you with? And then prioritizing and agreeing a priority level. And some things have to come back for a revisit or another appointment. And it's just being open and honest about that from the start, in a nutshell.
And with our better communication skills, maxing out what we can achieve in the time with that
Absolutely.
lovely smooth. I think there's that comment, isn't it? I get it wrong every time, but slow is smooth and smooth is fast. And getting that nice frictionless consult. So I'm going to sort of wrap up today, aware that we are approaching 1 o'clock, and a huge thank you to all our attendees for joining today, and in particular to our panelists and Simon as well for your bit earlier. Thank you all so much. It's a big part of improving sort of everyday life and the care we can offer our clients. And I hope some of the resources that have been put in the chat are useful, and that we can really urge that sort of willingness to learn and really focus on this sort of skill set that we need in our roles, as well as all our clinical skills as well. We have more sessions coming up in this series, so please do join them if they are of interest and helpful to you, or encourage colleagues to do so. There will be a post-event survey being emailed out. We really do value feedback on these. We try and do our research to find out what is needed and then deliver in response to that. But we do want to know what is landing and where we could improve and what else might be useful for it. And we will send resources by email to all attendees, and they'll be available on the RCVS website as well. So thank you all very much indeed. Enjoy the rest of this lovely day in whatever way you can, subject to work. And hopefully we will see you on future webinars too. Thank you all very much. Bye-bye.